Just yesterday, President Trump announced plans to ban vape flavors, a move supported by many in the medical community. The decision coming after a 6th person died from lung disease possibly linked to vaping. New Hampshire public health officials are working with the CDC to investigate reported cases of severe lung illness in the state. And today we are joined by state epidemiologist Dr. Benjamin Chan. Thank you so much for being here.
My pleasure. Thank you.
If you could, go ahead and talk about what e-cigarettes are and also just what is this severe lung illness that it's associated with?
Yeah, so we've talked about vaping before on health headlines, but just as a reminder, e-cigarettes, also called electronic cigarettes, are battery-powered devices which heat a liquid mixture to produce an aerosol. That aerosol is then inhaled by the user. We call this vaping. And these liquid mixtures can contain a number of different chemicals. Many will often have nicotine. Sometimes there's THC or cannabis products in there in addition to flavorings and other chemicals potentially harmful to health. Regarding this national situation, back at the beginning of August, a number of states began reporting a cluster of otherwise young and healthy patients who were hospitalized with severe lung disease thought to be associated with vaping, and they reported these to the Centers for Disease Control and Prevention. That initiated a national outbreak investigation, which continues. Multiple other states have reported cases. New Hampshire is also participating in this national outbreak investigation, and we're investigating reports as they come in. But as of yet, there has not been a clear cause identified for these illnesses. It does not appear to be infectious disease related. The concern is that it may be somehow connected to a chemical exposure from these vaping devices, but there has not been a single chemical or substance or device associated with all these cases.
Have there been any cases of lung illness located here in New Hampshire just yet?
Yeah, so a couple weeks ago we sent out a Health Alert Network message to healthcare providers throughout our state asking for them to report to us any potential patients or any patients potentially with vaping-associated lung illness. And so we continue to investigate reports as they come in, but we have not identified any confirmed cases of vaping-associated pulmonary illness in New Hampshire.
So what would you like to recommend to folks who might be using vaping products?
So unfortunately, vaping products are very common in New Hampshire. They're very, very common in our high school-aged youth. People need to be aware of the risks. Parents and guardians need to talk about the risks with their children. And it's recommended that adolescents and young adults do not use electronic vaping products, nor should pregnant women. Adults that don't already use tobacco products should not start using electronic vaping products, especially while this investigation continues. Adults that use tobacco products and are interested in quitting should use evidence-based therapies. That can include counseling and FDA-approved medications. E-cigarettes are not currently FDA-approved because the evidence is still mixed in terms of their benefits as a quit aid. And then people that are using e-cigarette products should not alter them. They should not add substances to them. They should not buy them off the street. And anybody that uses them and is concerned about their health or is experiencing lung and breathing problems should be in contact with their healthcare providers.
All right, a lot of good information right there. Thank you so much, Dr. Chan.